But, Mr. President, there's a story closer to home for members of the United States Senate. It doesn't relate to the children's health insurance program, but I think it's a story worth telling. It's a story about a member of the Senate family here, someone that most of us have seen many, many times, may not know his name, but someone who's gone through a life-changing experience because of no health insurance in his family. 47 million Americans have no health insurance. We who are privileged in the Senate probably don't lie awake at night worrying about it because a bad diagnosis isn't going to lead to bankruptcy for us. We're lucky. We're part of the Federal Employees Health Benefit Program. We got the best coverage in America. 8 million federal employees, members of Congress. We get an open enrollment period every year. Don't like your company? Change it. It's like shopping for a car. There's so many choices out there. You want a big plan, you pay more. More money taken out of your check. Less coverage, pay less. Less money taken out of your check. Federal employees have a good plan here, and it's been around for decades, and members of Congress benefit from it, and we have the peace of mind that comes with it. But we don't have to look far to see families who are struggling and facing terrible decisions because of the high cost of health insurance. They're everywhere. They're in every town, every county, every state, all across our nation. And they're right here in the family. There's a young man who works just a few feet away from where I'm standing here as an elevator operator. His name is Sergio Olaya. He's worked here off and on as an intern and now has been an elevator operator since last May. Always got a big smile on his face. Great young fella, says hello. And most of us, of course, see him and greet him and head off on our business. He's 21 years old, bright young man, happy disposition, a great future ahead of him. But a few months ago, Sergio, who works right outside this door as an elevator operator, had a tragedy strike his family. His mother died of an aggressive form of brain cancer. She was 61 years old. A single mom, Sergio was her only child. Doctors think she may have had the tumor for a long, long time, but the symptoms didn't show up until just 2 months ago, and then she died. Before that, she'd suffered a stroke, which left her paralyzed on her right side. She was an authority on health and nutrition, had worked for organizations including the Centers for Disease Control, USAID, UNICEF, and the Organization of American States. But she'd been unemployed and uninsured for 5 months when she got sick. Even COBRA, which is the way to purchase health insurance when you're not working, was just too expensive for someone with a limited income like Sergio's mother. As a result, when she died from this aggressive form of brain cancer, she left $255,000 in unpaid bills, hospital and doctor bills, $250,000. The hospital at first threatened to sue her son, Sergio, for payment. A lawyer who's helping him pro bono negotiated the hospital charges down, first to $216,000, then to $95,000. With another $40,000 in doctor's bills, Sergio, our member of our Senate staff here, still owes $135,000 in medical bills for his mom. How's he dealing with this? He's selling his home in Bethesda, where he and his mom have lived for the last 8 years. It's the only home they've ever owned, and the proceeds will go for the payment of these medical bills. Sergio said that when his mom got sick, she'd been waiting to hear about a possible new job with the federal government, and it would have had health insurance. When the job offer finally came, his mom had just suffered a stroke and couldn't even get out of bed to answer the phone. 2 months and $255,000 in medical bills later, she passed away at the age of 61. In another week or month, she might have had health coverage with a new job. In another 4 years, she would have been eligible for Medicare. Instead, she had the bad luck and bad timing to fall through one of the gaping holes in America's unraveling health care safety net. Now, her only child, her son, is paying the price. I wonder how many of us senators have been in the elevator with Sergio, talked to him, shared a smile with him, but had no idea of the terrible burden he and his mom were carrying as a result of the cost of health care and the cost of being uninsured in America today. How many more families are going to have to sell their homes? How many more bright, talented young people are going to have to drop out of college so their family can pay medical bills before we finally come up with a real plan to make health care more affordable for all Americans? The truth is, almost every family in America is at risk because of a fraying and failing health care safety net. Almost all of us could be one pink slip, one election, one bad diagnosis, or one serious accident away from a health and economic disaster for our family. This affects Sergio. This affects our Senate family. It affects all families. We need to deal with it. We need to find a way, or a combination of ways, to give every American access to affordable health care.